All right, big bag and big wallaby, huh?
Definitely, yep. Yeah.
All right. We might just try to get him out nice and gently.
Come on, matey.
Oh, mate. It's Hugo, isn't it?
Hugo's his name, yeah. He's a redneck wallaby.
Okay.
And about a week and a half ago, we noticed this big growth that had come up in his ear, so it seemed to have come up really quickly. And it's very large, as you can see.
It's big, I mean, and it's also really filling up the entirety of that ear canal there. And quite firm too. The moment I look into that ear, it's very clear exactly why Ben's worried. There is a big lump in there, and it sounds like it's come up really quickly. So there are really two extremes. At either end of the scale, we have an abscess, which really isn't such a bad thing. We can treat with antibiotics and it should heal, through to the other worst possible case scenario, which is a tumour.
So he was bred in captivity, and when he reached sexual maturity, he started to get a little bit boisterous. So
really?
I had to rehome him, so they gave me a call.
Yep.
So he came to us, and we've had him for about 8 months now.
Since he's been with you, has he been quite calm?
Initially it was quite interesting to see how he reacted with the other roos. So he sort of came in, and I think he's got a bit of small man syndrome, being the wallaby, and there was a few big red kangaroos twice his size around. And he had to sort of prove himself to them, but pretty quickly they put him in his place. So of all the roos we've got at the sanctuary, I think Hugo's probably one that I've got the closest bond with, and I think that's got a lot to do with his really outgoing personality. He's just got a lot of character, and he's always sort of jumping around and causing mischief around the sanctuary.
The challenge is if you have one lump, you just want to make sure you don't have two.
Yeah.
And so I'm going to great lengths to feel all over him there to make sure there's nothing else that shouldn't be there. Okay, I'm pretty comfortable there's not. What this clean bill of health for the rest of him means is that I can really now start to focus just on his ear. The logical thing is to try to get a needle in there and take a sample.
Yeah.
And that's at least going to start to narrow down the options in terms of what it could be.
For sure. Come on, mate.
Okay, so this is just to clean up the skin there.
At the Bondi Clinic, Chris is about to investigate what's inside a disturbing growth on the ear of rednecked wallaby Hugo.
So, I'm not sure if it's the right jab or the left hook I need to worry about, but let's just see how we go.
It's all right, I've got your back.
So I'm right in the middle. If I put the needle in and draw back pus, we're looking at an abscess. If I put the needle in and draw back not much at all, apart from just a bit of tissue, then I'm concerned, because that could indicate we've got a tumour in our hands. Okay, immediately we're getting blood there, and quite a bit of it. Yeah, wow, okay, I did not expect that.
Boy.
All right, well.
What do you think?
Yeah, that's a surprise. After the initial shock of seeing the blood in the syringe, all of a sudden, everything begins to make sense. Hugo has blood in his ear, an oral hematoma. How do you get an oral hematoma? Well, if you're a wallaby, it's from fighting. What does Hugo have a reputation for doing? It's getting these out. It's the same way a boxer gets a blood clot like that.
Yep.
I'd say he's copped a stray right hook. He's actually been boxing with one of those big red kangaroos, and they've landed one on him.
Okay.
The thing is, we can't just leave a big blood clot like this in Hugo's ear. What happens over time is the fibrous tissue in the clot starts to tighten down like it does in a scab. When it does that, it really shrinks down all the tissue around it and really causes what is essentially a cauliflower ear. If that happens in Hugo's ear, it'll really render that ear useless for him, and ultimately he could become deaf as a result. So this little brawler has suddenly had his personality catch up with him.
Hey, it puts you in your place, mate.
Yeah. So really what I think we need to do is to get in there and remove that blood clot. Now, I obviously can't do that with him awake. What I need to do is to give him a sedation and make a little cut on his ear and see if we can actually pluck that clot out.
Okay.
How do you feel about that?
Well, if it's got to be done, definitely I want to make sure he's happy and healthy long term. So if it's going to affect him long term and he's going to lose that hearing, then ultimately I'd rather get on top of it now before it gets any worse. So.
Yeah. Something a little bit different.
Back at the Bondi Clinic, Hugo, the troublesome wallaby, has been sedated in readiness for surgery on his ear.
So Hugo isn't aware of his size, but Hugo likes to use his fists for bad reasons.
Oh, well, everyone likes a bad boy.
Yeah, well, he's that.
Out in the waiting room, Hugo's keeper Ben is worried about his little mate.
There's a lot of risks involved in sedating a wildlife species, so I'm a little bit concerned, but it's got to be done, so yeah, I'm sure it'll be fine.
So that's another 9 mils I've managed to get out there, so that makes a total of 15 mils of blood that has come out of this ear of Hugo's. What we're really left with now inside his ear is essentially just blood clot. So this is the stuff that's going to cause him problems. Okay, I'll get all cleaned up myself and then get started. Hopefully what this surgery achieves is to remove the blood clot that's in there and also bring those layers of skin back together and seal them against the cartilage of the ear. Okay, so the challenge here is to incise into this blood clot without actually starting a whole lot of new bleeding. So I'm inside it now and it's very firm. I'm actually having to spin it around and really break down scar tissue. The more I can break up of this clot, the more chance we have of actually stopping this cauliflower ear from forming. We've got an area above it where there was the lump before. Now that's skin that's lifted off the cartilage. We need to really anchor that back onto the cartilage, otherwise it's a space that's just going to refill with blood. So in order to do that, I've got a little bit of a trick up my sleeve. Kind of literally up my sleeve, because what's up my sleeve is what I'm going to use. The solution to this problem, it's not exactly high tech. In fact, most of us are carrying around the solution every day of our lives. The answer to all of Hugo's problems is buttons. The ironic thing is, I can't put buttons back on my shirts. Hopeless at it. But I can put buttons in animals' ears. Somehow it's different. The key to the buttons' success is the fact they really provide a flat surface that you can anchor onto the inside of that ear and attach in place. Once it's there, it makes sure the skin is firmly fixed to the cartilage. So the challenge is just getting it nice and firm, which it is. Okay, then we've got room for one more. So I'll just put that in that space there. Okay, so we've got 3 buttons in there. I'm pretty happy with how that's managing to really compress those layers of the ear together and prevent blood from filling in between there, which is ultimately what caused the whole problem to start with. The one thing I'm worried about is the fact that with those claws of his, he can actually get his foot up and push those buttons out. What I'm thinking is I'm really going to have to bandage his ear just to stop that from happening. Okay, we are done. Let's wake him up. Now the procedure's all done. Hugo looks $1 million. It's time to wake him up and get him home. What have you done?
Now all the lovely lady wallabies will know who that hot piece of tail is.
Liesel's decided that the feminine touch is really the key to Hugo's future. I'm not so sure. It stands for hot man with buttons, right?
I was going for Hugo, but yeah, that's the other interpretation, of course.
Yep.
Keeper Ben has been waiting patiently for news of Hugo.
Yeah, definitely been watching the clock tick by. It's been almost an hour now and we haven't heard anything, so hopefully they'll be coming out soon with some good news, I hope.
So?
Oh no. Hey big boy.
Here he is.
How'd he go?
Look, he went really well.
Yeah.
Yeah, he came through the operation brilliantly.
Okay.
So he's just waking up now. I guess I've got him out to you a little bit earlier than we normally do.
Yeah.
Just so he is still a little bit sleepy when he goes home.
For the trip home?
Yeah.
Cool. Big surprise to see his ear all wrapped up like that. I love the little touch with the H and that was very nice. And great relief just to hear that the surgery went really well. I think we'll have to find him a girl one day.
Turn this fighter into a lover.
Alrighty. Thank you very much, Chris. Really appreciate it.
No worries at all.
He'll be fine. I'll let you know how he goes.
It'd be great. And if we can see him in a couple of weeks for that, get those buttons back.
Great. Thank you very much.
Safe trip home, huh?
Thank you.
There's no doubt that Hugo goes home a lot more colourful than how he came in, but my hope is that he finds that special someone and his days of fighting are all over.
Yeah, they're all clogged up. I mean, he's hardly got an ear canal now. The ear canal's just blocked up. It's just full of hair again, and that doesn't ventilate.
Yeah.
That's why he's having so much problems.
Yeah.
And it then catches a bit of dirt, a bit of wax, and infection and inflammation, and they get very sore, buddy. The way he's going, he's going to end up going deaf. You know, it's been every few weeks he's had to come in for his ears to be done. It's not fair.
He's been very brave, aren't you? You're a good boy.
When I think about it, it's very sad. It was only like about a week ago that we were here, so it does upset me. Bruno is very beautiful, loving, happy dog.
Good boy, Bubby. You good boy. Yeah.
Bruno is just wonderful company for me because my children have all grown up now. So it's just me and him at home. So he's great company and we're very close.
So look, I think we'll go with what we've planned. It's a lateral ear resection. This is a long-term surgery.
Yeah.
It'll be a few hours of surgery itself.
Okay.
After 4 years of constant vet visits, Maggie and Rob hope today's operation to reconstruct Bruno's ears will provide a permanent solution.
His ear canal, you know, instead of going down and having a right angle bend, his ear canal will come straight out.
Okay.
So it drains easier and it's all open to the ear, it ventilates, and it'll help quite a lot. And he'll need on both sides, I'm afraid, because it's just been happening too often for him.
Okay.
Too much.
And that will make a big difference, like in the future.
Big difference, yeah.
Yeah.
All right,
Poor
Bruno.
little. He's a lovely, lovely dog. So with this, hopefully he'll feel much more comfortable and a lot less visits to the vet. See you later, buddy.
Good.
You're going to be much better. Okay, love you. Love you. Thank you so much,
Pleasure.
Rob.
See you
Bye.
later.
Thank you. Bye.
In Sydney, 4-year-old Bruno is being readied for surgery to fix ongoing blockages in his ears.
You go.
Rob will reconstruct the canals in both the Lagotto's ears, hoping it will put an end to the painful inflammation and infections caused by repeated blockages.
There we go. I'm getting worried because he's been in so many times. The normal things, the normal drops and tablets and swabs and everything else that we've done hasn't worked long term for this dog. So it's time to get in there and get very serious for him. Thumb forceps, please, Annie. Thank you. He's going to be suffering this for the rest of his life if we don't do something. And that's what we're hoping for, that we get resolution to the problem. Now, you don't always, but I've never had a case where I haven't had improvement. And so what we've done is we've placed the artery forceps right down the ear canal, and now we're cutting down the side of those forceps. We're removing the lateral part of that canal. We actually don't detach it from the body. This is the trickiest part because what we need to do is keep as much of this lateral canal as we can, literally as a splashboard for the ear canal to come out of. The splashboard, as such, is the lateral part of the ear canal. Instead of just cutting it away and throwing it away, I pull it down and allow it to aid in the drainage of that canal. You're coming down to here, right down, pull you down, pull this up. Yeah, I guess he's going to get a facelift because the skin does get pulled up a lot. But dogs have very mobile skin, very mobile skin. And now it's an exercise in suturing, trying to get it all in the position that we want. Each suture has to be put in, just pretty precise, or it won't heal.
Bruno requires dozens of stitches.
Last one.
As Rob completes the successful reconstruction of the young dog's right ear.
Very happy with this ear. As you can see, there's the ear canal there. Just when it comes down, it'll allow air straight into the canal itself. Very happy with it. So, half time, swap sides, the whistle blew. 2, 3. Here we go, baby. Let's go. I guess some 70 to 100 stitches in the other side. I didn't count. And believe it or not, the ears are not symmetrical. So I'm prepared to find an entirely different canal in this ear. Go. Stop. Get that skin back there.
As Rob starts work on Bruno's left ear,
A bit more trouble with it than I'd like.
he immediately faces a major challenge.
It can't be that different. We are starting from scratch. This one's going straight down, so we've already got a bit of a difference here.
In Sydney, Rob has successfully reconstructed 4-year-old Bruno's right ear.
It can't be that different. It is that different.
But surgery on the dog's left ear looks like being a huge challenge.
Tougher one, isn't it?
It's tough.
Try that.
Okay.
Yeah. It's common for many dogs that the canal that goes downwards first and then across. And so everything's supposed to drain uphill. Well, I guess you know, nothing drains uphill. And it's quite amazing, such a big difference to the other ear canals. It just mean a slight adjustment, or a big adjustment actually, on where we cut and how we cut. Okay, there's the canal, and it's full of hair. So this black hole is the canal. And look at all this. We'll take it out now, which we've done over and over again, but it grows back. You can see why this would irritate him, because it's all our hair deep inside. Is going to be a great environment for bacteria and fungus to grow, and then that causes severe inflammation. It explains why it's been so sensitive to this dog all the time. When dogs get an ear problem that goes on a few times, it often becomes very chronic, very hard to get rid of. And in Bruno's case, just producing a lot of hair. I don't see that a lot in Legatos, but in his case, he's producing a lot of hair in there all the time. Literally what we're doing is giving him a Brazilian in his ear. So getting rid of all the hair and muck will probably improve his hearing quite a bit. Okay, baby boy. That'll do. So now we start suturing, just plenty of it. Probably about 80 to 100 to go on this one. Everything all right?
Yes, yes.
110, that's good, it's nice and steady. It's been that right through.
Despite all the challenges, Rob has managed to remodel Bruno's left ear.
I'm looking right into the canal. It's looking at me, breathing a sigh of relief. I swear I can see this ear canal breathing. Certainly smiling at me.
Both ears should now drain better, with problematic hair regrowth greatly reduced.
So I'm happy this is all done.
The surgery will make a massive difference to Bruno's quality of life.
It'll make a new dog out of you. Whew. Thank you, everybody.
Thank you.
It's gone well. So he goes into recovery now, and he'll just wake slowly from his anaesthetic. So he'll be here for a few days, just on pain relief. And I talk to them and they tell me when they're ready to go home. If he settles, we won't. Put a knee collar on him. He's starting to look good. I'm happy with him. He just don't want him to shake his head, of course, or scratch at his ears. Just hoping the tranquilizers and the painkillers will be enough for him. So there he goes. Good boy.
6 weeks after Bruno's surgery on both ears, owner Maggie is overjoyed with how well the 4-year-old is recovering.
So Bruno is much better and he's not having trouble with his ears. He's a lovely, lovely dog. Very friendly with all the other dogs. Loves going to the dog park. Loves swimming, taking him to the dog beach and swimming pool. So he's great company.
Now that Bruno's ears are no longer painfully clogged, the playful Legato certainly has a new lease on life.
You good boy? You good boy? Yeah, you feel
Been infected for about 3 years, but now he's got this horrible growth in there as well, which is grown probably in about 6 months. And
Even after 3 years of daily cleaning and medication, nothing has fixed Dusty's chronic ear infection.
Ooh. Not good, is it? Has he got an ear canal?
it's pretty hard to see these days.
I'm looking at Dusty's ear and he's got this festering, for want of a better word, horrible ulcerated ear canal. I can't see down into an ear canal at all. It's totally obstructed by this mass. So it's obviously horribly infected, and we've got this big knobbly growth there that might just be part of the infection, or I guess it could be something a bit more nasty than that. Oh, mate, you like that. And it smells to high hell. You've been treating his ear for 3 years on and off, or pretty much on?
Well, pretty much more on than off, really.
Paul and Jeanette have done an amazing job with Dusty. They've been really dedicated. They've just done everything they can to try and get his ear to be fixed. But I really think that unless we do something now, they'll have to seriously consider putting him to sleep, because he's in a lot of pain.
So it's a mess.
It is a mess, isn't it?
Think about your own worst earache and multiply it by about 50. And he's had it for 3 years. What he's been going through is not sustainable. Touch wood, he's in good hands, and we move on.
Jeanette and Paul have spent the last 3 years trying to fix the courageous pup's ear.
Oh, mate, you're very brave, aren't you?
Yeah, he's pretty good.
You can almost not get in there to clean.
Oh, I think you'd be doing amazingly well.
Well, I haven't stuck anything down there. I kind of put the syringe down there and it gets part way in.
Okay. There's no amount of medicines and antibiotics or whatever. We can spend another 18 months doing that.
We've tried them.
And to be honest, it's cost us a fortune. It's been, it's $1,000 a month on medication. It's like it's mad.
The situation is now so desperate that the only solution is an extreme operation.
But I think the only way we're going to fix that is to remove it entirely, and that means he loses his ear canal. So he won't have an opening there at all.
Okay.
And that sounds really radical, and I'm sure Paul and Jeanette have gone, gosh, what? Unfortunately, there's nothing else we can do.
Yeah, it's a pretty drastic step, but this has been going on for so long. I think that we're happy to look at what the next stage might be, especially if he's going to be so much better.
The radical surgery is set for tomorrow.
Come on, Dust.
Come on, mate.
It's the only chance Andrew can give Dusty for a life without constant ear pain.
We'll see you soon.
All right, Dust, you good boy. You're okay. If we don't do this, he's just going to get worse and worse and be in pain forever. Hey, Dusty. Hey, stinky dog. How's that ear? All right, you good boy, we'll get you asleep.
At SASH, there's no mystery about Dusty's chronically blocked ear. Andrew's anaesthetising the 8-year-old to assess how he's going to clear the ear in surgery.
This is the first chance I've had to have a good look at Dusty's ear with him asleep. There was no way I was going to have a look beforehand. And it's a mess. I mean, there's no other way of describing it. It's bad news. Well, we're definitely going to make you better. Oh, yuck.
A CT scan is needed so that Andrew can see just how deep Dusty's ear infection is.
I'm looking to see what problems we might have in the middle ear, which is a big bony, normally air-filled cavity. But when you've got chronic infection like this, there can be a whole pool of infection sitting in there, and I want to see what's going on. We've got the scan of the skull out, and so that's normal. We go across to the other side, and we've got this huge bulbous extension of this middle ear. All of this is infection, and it's slowly expanded this bony cavity, so that it's now about 3 times the size that it should be.
The results are worse than expected, meaning the already risky surgery has just become even more dangerous.
Because there's so much infection in there, we're going to be really close to his inner ear, and there's a chance, as careful as we'll be, we'll damage that, and that could affect his balance. Dusty's ear is about as bad as I've ever seen.
At SASH, Andrew was performing radical surgery on Dusty's ear.
This is awful.
The Cocker Spaniel has been plagued with years of chronic ear infections. The situation has now become so desperate that his entire ear canal is being removed.
We had no alternatives for him. He's been in a lot of pain. His ear is so infected that unless we actually remove it, we'll never get him better.
But it's an extremely delicate operation.
It's a high stakes game for Dusty. I mean, if we damage his facial nerve, he won't, potentially he'll never be able to blink again. Just starting to feel his skull now at the bottom of my scissors, so we're very close to where this ear canal attaches to his eardrum. But this is where it's all a bit scary. Just down right at the base of his ear canal now, so I'm almost about to separate it from his head, and I can just see the infection starting to ooze out.
At SASH, Dusty's delicate ear surgery has reached a critical moment.
There it is. That's just a horrible infected manky bit of tissue. Dusty's going to be a whole lot better off with that out of there.
Andrew has removed Dusty's entire ear canal, cutting dangerously close to delicate tissue.
Now we've just got to get out every last skerrick of infection deep in his middle ear. Got to be really careful. Now I'm just literally digging around inside his middle ear. And his whole middle ear is just falling apart as I touch it because it's just so rotten, literally. He's got a bone infection as well because of this ear infection. It's pretty bad. He must have had not only an earache, but one hell of a headache for a long time. I think he was on the edge, to be honest. I think if this had gone on for much longer, he would have ended up with a brain infection. Because there's all this infection sitting right on his inner ear, and his inner ear is just a doorway to his brain. So I think we got this just in time.
Dusty's hearing will be mildly affected, but the question is, long term, how much will the surgery affect his inner ear?
As he wakes up, well, he should get a bit of an idea of whether I have upset his balance at all. So I'm really hoping that hasn't happened. Hey, little man.
Following radical surgery to remove Dusty's chronically infected ear canal, Andrew is anxious to see if there's any nerve or middle ear damage.
I just want to check to see if we've done any damage to his facial nerve and see what his balance system is doing. I always check it as soon as I can when they recover because it's our biggest worry. I can blink. It's a little bit weak compared with the other side. So I suspect that I've stretched that nerve a little bit. Certainly haven't permanently damaged it. Often if they've damaged their balance system, their eyes just flick sideways like this really constantly, and he's not doing that, so that's good. So I mean, that's really encouraging because I was really worried about that. I personally think that Dusty will actually be feeling better. He had a horrible earache, he had a headache, and I think all that pressure is going to be relieved. I think he's actually sighing a sigh of relief now. Hey Dusty, how you going, mate? How you doing? You're looking all right. Shall we get you out and put you on the ground? See if you're not all wobbly?
Days after Dusty's drastic ear surgery, the moment of truth. Has the operation affected his balance?
How are you doing? One of the big problems with this surgery is when we're deep in there, we can potentially damage sort of his balance centre. Then they can literally wake up with their head on an angle like this and even rolling around in their cage. Gee, that looks all right, isn't it? Hey, how's that balance? Hey, that's pretty good, isn't it? I think I was worried about nothing.
With Dusty given the all clear, it's time for him to go home.
Come on. Come on.
In reception, a special visitor has come to welcome Dusty back to the family.
So we've brought Mia, Dusty's sister, with us today. She's been very lonely without him. She's pretty attached to Dusty and she's been at home crying. So hopefully it'll be a happy reunion when she finally sees him.
Hey, Dusty. Who's that? Who's that? Ah, there you go.
Hello. Very nice, yeah. Oh, I like your mohawk, mate.
You like his haircut?
I love the haircut.
Oh, wow. So he's got a bit of swelling just in there.
Yep.
But yeah. So his ear canal used to be there. I know.
It isn't touching it.
Stop mucking, man.
Dusty looks really good, yeah, really happy to see him.
Yeah, he's good.
Obviously well, but you know, the ear looks really kind of clean and he's just a different dog. Good result all round. Thank you so much.
That is a pleasure.
Thanks, Andrew.
All right, that's
Great
cool.
job.
No, it
Such
is
a relief.
it's a lovely dog, and I'm sure he'll be feeling so much better. Yeah. See you later, guys.
See you later. Bye-bye.
See you, Dust. When Dusty gets home, his life will be totally different. He's not going to be in pain anymore. He's not going to smell anymore. Paul and Jeanette don't have to put up with that smell, and they don't also have to put up with having to medicate him every day, twice a day. It's going to be so much better for everybody.
Good boy, Herb. Good boy, good boy, good boy, good boy, good boy, good boy.
As soon as I look down the scope, there's something very dangerous and very nasty down there, and I'm quite worried about Herb.
Oh dear. Oh, yes, it's understandably sore, mate, because he has got a nasty grass seed in there. It's really, really far down the canal. I must admit, I'm a little concerned about his eardrum based on where it is, because it is so far down his ear that it could be perforating or rupturing his eardrum.
You poor love.
Grass seeds are really nasty little things. Basically, they're in the shape of an arrowhead, and every time a dog moves, it'll burrow further and further and further into the dog, and you're unable to pull them backwards because it flares, and it's just such a painful process for them to go through. So to see one in a very delicate position, teetered on the edge of an eardrum of a dog, it's serious. It's not a simple ear infection, I'm afraid. So we have to give him something to make him sleepy, and we'll get that pesky ear sorted out, and then once he's woken up, we'll give you a call and we'll talk it all through.
All right, lovely. Thank you very much. Oh, thank you.
Good boy, take me away.
Yes. I couldn't ever imagine life without Herb. He loves his teddy, don't you?
Come on then.
Say bye-bye. Can I say bye-bye to Herb? Yeah, give him a big hug.
That grass seed is lodged right at the base of the canal. It can go right into the middle ear. It can affect his balance. It can affect his nervous system. So there are some very serious ramifications. Hey,
Hello.
so this is Herb, great name.
That's a brilliant name.
With Teddy and cards in hand, so we need to make sure they're ready to go.
Interesting.
Scott and head vet nurse Emma are about to try to remove a grass seed lodged dangerously deep in Herb's ear canal.
He's going down now. Okay, I am worried that Herb's eardrum is perforated. It's really bad. It's very, very deeply embedded. I'm almost certain this is going to have been down through his eardrum.
Oh, bless him.
That is nasty.
Oh, that's huge.
Can you think of that trying to burrow into your head?
Oh.
The grass seed we removed from Herb's ear is a nasty one. Very, very sharp. It's got the feathered edges, so it was only going in one direction, and that's going right through Herb's ear and then into his middle ear. That is exceptionally painful and cause a huge amount of damage.
One to show Mum.
I think Herb would have been in a huge amount of pain. Surprising that he's really not showing those clinical signs. He's a very calm, easygoing fella, but I tell you what, if I had an ear that was full of grass seeds, I'd be screaming my head off. Let's have a little look at his eardrum now.
There's a lot of blood and damage down there and infection, but unfortunately I can see a bit of a hole.
These grass seeds are very damaging to animals, and when they burrow into that level, they can cause all sorts of neurological dysfunctions. I think in this case, we've caught it just in time, because if it was any longer, it could have been a lot worse.
Oh, there's one. There he is. Oh, he was starting to work his way in.
Scott and Emma are now searching for any other grass seeds that may be camouflaged in Herb's golden fur.
Oh, there's another one.
Oh, and here as well. Add it to the pile.
Grass seeds aren't as simple as just a prickle in the foot. They can be a real disaster. They actually can harpoon any organ that they find on their way through a dog's body, and they'll only really stop when there's bone. They can cause real problems.
They're so sharp and so spiky.
Nasty little things, aren't they? We get to 9 in total. Poor old Herb, he was focusing on his sore ear, but in fact all the while he had feet absolutely riddled with grass seeds.
Yeah, no wonder he wasn't himself. Poor guy.
No. Braver than I would have been.
With all the grass seeds removed, Herb will spend the afternoon sleeping off the sedation.
Aw, he's going to want his teddy to wake up with.
Of course he is.
I
There you
would.
go, mate. The damage that we've found in Herb's eardrum is significant, but I do hope it'll heal up and eventually he can get back to his water-loving ways. Good lad.
Later that day at St Margaret's, Joe's dog Kimber has taken over reception.
Hello. Is this the new receptionist?
Yeah.
It's a special welcome for Melanie, Florence and Oscar.
If only. Yeah, shame she's a rubbish typist. Absolute rubbish, aren't you?
They're all anxious to find out just what's happened to their Herb.
When the kids left here, they were really anxious. They suddenly went into complete mode of, oh, we want to be with Herb, we want to be with Herb, will he be all right? What will they do to him? How's our Herb?
He's been such a brave boy, but it's a very serious finding that the eardrum on that left side has been perforated, unfortunately.
Oh,
so he's got a
gosh.
hole in the eardrum. So where that grass seed, which is this nasty little thing, look at that, kids, look.
Oh my gosh, that's huge.
It's gross, isn't it?
Oh. Yeah, I imagined a grass seed to be the size of a pinhead, but it was a lot bigger than I thought, and it was spiky on the end, so nasty. Oh.
So thankfully it's out. We've flushed his ear canals, but the hole's a decent size. It might heal, it might not. If we get water down there, that can affect his balance, it can cause infections, it can even affect his neurological systems.
I don't know how Herb will handle not swimming. He loves swimming in the sea. I mean, he loves the sea.
But also what you guys have got to promise me is that you need to start looking between his toes after every walk. The reason being is that I found not 1, not 2, but 9 grass seeds between his toes.
Oh my Lord.
See all of them?
Oh, it's horrible. It was pretty horrifying, really.
Now guys, just so you know, he's just had an anaesthetic, so he might be a little bit woozy, look a little bit drunk, okay?
Oh no.
It's been on the wine.
Drunk man.
It doesn't get that from me, by the way.
I know.
It's not from
It's
me.
very authentic.
Yeah.
Herb is pretty desperate to get home. We could see he wasn't keen on coming into the practice, but he's very keen to get out. Good boy, that's it.
Show me the dog. Where's my Herb? Give me my animal.
Yeah.
Hey, baby. Here we
go. Who's this?
Hello.
Whoa, there we go. Herb's done so well, brave mite, and I think even though he's a bit wobbly, I think that he's going to be much happier at home, snuggling up with Melanie and the kids, and of course his cute little soft toy.
Where are you going to put the grass seeds?
Do you want to keep it for show and tell?
Yeah.
Yeah?
I want to keep it for show and tell.
Herb's been really lucky this time. So I'm glad we got him into the vet and we've got it all sorted in time and hopefully he'll be fine now. Thanks very much.
Take care, no
Thank
worries.
you.
See you
What'd
later.
you
Bye,
say?
Florence
You wanna say
Basker.
thank you?
Bye, Herb. And soft toy and card. Lovely.
Come on then, guys. Off we toddle.
Now you're shy. I tell you what, she's been so happy and excited to be here and be with us. Yeah. Very, very friendly. There we go. There's the little lady. Do you want to give Daddy a cuddle? Yeah, man. Working at my practice, you do get used to famous faces. So when Jesse Wood walks in the door, he's just a normal, easygoing, really nice guy that just happens to have an exceptionally famous Rolling Stones father. He's got a very old cat, nearly 21-year-old cat called Rudy. He's a dad of 3 kids at the moment, soon to be 4. I'm the father of 3. And that's where rapport starts, you know? And yeah, we get on great. So mate, look, she is just doing so well. She's actually a bit of a medical marvel, really, in that her bloods, so we've done a whole bunch of bloods leading up to today, and they're all perfect. You would not put her and those bloods in the same room. She's got the bloods of less than a 7-year-old cat, and at the moment she's kind of like our
the great-grandmother of the practice, if you will. I mean, she is literally our oldest patient. And you've had it for how long?
It's going to be nearly, it's going to be 21 years almost. I don't know how you mark it at the beginning of the year, isn't it? So I'd say 20, 21 a month.
So in cat years, that's 140. Now, normally, we wouldn't go near a cat of this age to try and do a procedure. It's nerve-wracking for me as much as it is for you. But she is such a fighter. She's so strong. And also her hypothyroidism, which you've been managing beautifully, the thyroid level is well back into the normal range. So there's really no impediment to moving forward. And obviously what we have got though is an issue where you've got a young son who likes patting the cat and you've got a lump that looks like that. We don't know what that lump is. And of course now it's breaking open, it's becoming infected and it is bothering her. So it's leap of faith time. She's an old lady, she deserves to be comfortable. So we need to be brave and we need to go for it and just try our best.
She's very loving, very chatty, very demanding, a very happy cat. She loves all men, I'd say, especially Scott. Right, good luck, miss. Shall I put her back in here?
Yeah. There you go, sweetheart. There you go.
Good luck. See you on the other side.
She's still purring throughout the whole thing.
She's been doing this since she walked in the door.
If only our patients were all like this, eh?
Our life would be a lot easier if they were.
Although she's kind of like a great-grandmother, she's obviously the
She
granddaughter of an absolute rock legend.
She really is.
In Ronnie Wood.
Very much so.
I wonder if he knows she's having a big up today. We are gonna do a very simple kind of nip and tuck almost, I think, with this one. Just slice it off, control the bleeding.
And suture it closed.
Suture it closed, and then wake her up as soon as we can, just to get the result we want without too much fuss. I've been a vet for 17 years, and I think if you don't have some level of apprehension, then you're not doing your job properly. All right, so clock's ticking. All okay there, Ems?
She's given me the numbers that I would expect off a 5-year-old cat at this moment in time, so very happy over here.
This might not be the most beautiful of surgeries, but it needs to be quick. It's a lot of responsibility, so we take that very seriously. And you know, she's a gorgeous cat who makes our job very easy. So we're going to do our absolute best to get her through this. Okay.
Okay, ready?
Yep. And that's that.
Good girl, Rudy. That's what we like.
It's not very often when my heart's actually racing just doing a stitch up. Because she does feel like a member of the family, and you know, there's that extra bit of heart and soul
that goes into the job.
And she's just so gorgeous. You know.
Absolutely, 100%. I think the ethos, behind us is our love of the animals and dedication to our patients. We don't want to be a factory.
So Rudy, her heart rate is ridiculously normal for a geriatric cat who is undergoing an anaesthetic and a surgical procedure. You would expect with the drugs that we've given her and that her heart rate would drop considerably. The risk of her stopping breathing or heart stopping was very, very high, and the numbers that I'm getting here, she's been a rock star. Good girl, Rudy.
Oh man, heart in my mouth. Right, and that unfortunate earring is now gone.
Record timing.
I've heard of speed dating, but that was speed surgery.
Under 15 minutes.
She's a bit old for speed dating anyway.
There's nothing wrong with grannies going out on a date.
Good girl. Come back to me, come on. Good girl. Come on.
Good girl.
Well done. There we go.
Well, that was definitely one of the most stressful anaesthetics of my life. Welcome back.
Oh, right.
Yes. And breathing.
Mini high five.
Mini high five. Job well done.
Her heart was going, our hearts were going.
Yes.
She was breathing, we were not.
She did it all for us.
She's already started purring.
This cat's ridiculous.
You are ridiculous, eh?
superstar.
Now I get to call your daddy. How cool is that? Give him the good news. Hey Jesse, it's Scott.
Hi Scott,
Hi mate. Well, don't worry about me. The good news is that Rudy is absolutely fine. I've got her in my arms right now. She was an absolute trooper. She had good breathing rates and heart rate. She had better than Emma and I during the surgery. And she's come out the other side, and she's an absolute star. So we're elated and we're really happy for you guys as well.
excellent.
I'm so proud of you for letting us do this. I'm so glad that we've managed to get the result. And fingers crossed she'll be able to come home with you tonight.
Wicked, all right then. I'm really grateful for everything you've done.
All right, mate. Take care. Speak soon.
Right, bro. Cheers.
Bye. Bye.
Bye.
So we've done it, my beautiful girl. And who knows how much longer we're going to have with you, but today is not the day. And we both need a stiff drink.
Afternoon, how are you?
I'm good, how are you doing?
Yes, good. Girls nearly ready. Scott's
Cool.
getting her ready to go.
All right.
See,
Cool,
out with you in a
thanks.
sec.
Great, very over the moon. So's my wife and kids, so it's all good.
Hello.
Oh, hi.
So here is your beautiful and very brave little girl.
Oh, hello, darling. How are you?
So, yes, we got away with it.
Yeah, that's great news, isn't it?
And yeah, you can see it's a fairly neat little suture line. I was very impressed with how strong she was under the anaesthetic.
Yeah.
No problems whatsoever. I think we were more nervous than she was.
Yeah. Okay, well done, my darling. You've been very brave. Take you home now. Well, she's been through a lot of bad times as well as good times, so I had every faith in her.
Here we go. In you go, honey bunch. Back onto that posh cushion of yours.
Here you go, Ladywood. There we go.
Good girl. There we go. The big thing is that she is an old girl who's made it through what could have been, you know,
yeah,
the end. So
brilliant. Well, thank you very much.
Oh, pleasure.
Thank you. Really appreciate it. All right, mate. We'll
take care.
Cheers.
See ya.
Bye.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.